Sciatica has become quite a broad term that for patients tends to mean, back pain that's going down the leg. It can occur as a result of a lot of different modalities. There is a specific sciatic nerve. Sometimes it can be different nerves that are getting pressure placed on them that can cause this pain down the leg. The most common symptoms people experience with sciatica includes back pain. They experience pain down the leg, numbness, tingling, burning sensations. Sometimes people do develop some weakness, trouble walking. That's in more extreme forms of sciatica, but those are all things that you can expect to see. Sciatica can be caused by a number of different pathologies, including things like disc bulging. You can have severe arthritis that puts pressure on the nerves. Sometimes the nerve can have pressure on it kind of lower down in the body in other different areas, but primarily it's related to pressure within the spine. Any sort of injury that can affect the back or leg can lead to sciatica, especially any high impact injuries or anything that causes a lot of torsion, twisting on the back that can lead to disc bulging. But it's also something that can occur over time as people get older as a result of degeneration of the spine and the discs as well. Absolutely. People who are doing a lot of hard impact occupations, hard impact activities, that can lead to quicker progression towards those types of symptoms. In addition, things like posture can definitely lead to that. Lifestyle modifications make a big difference because increased fitness level kind of decreases the chance of progression of things like arthritis, degeneration of the discs that can cause symptoms like sciatica. So sciatica can be diagnosed in the clinic based off of the patient's symptoms themselves. It can be confirmed with imaging modalities such as MRIs. Physical exam is also important. When we see the patient, we do a thorough physical exam to make sure that things are not progressing too quickly and that we are getting imaging of the correct locations and able to treat the pain as soon as possible. Yes, there are red flags, symptoms that we do look for these patients who are having progression sciatica, and some of these symptoms include things like significant weakness to where they can't walk or stand, significant sudden numbness, anyone who has any incontinence, going to the bathroom, severe numbness as well. So those are all things that we look out for these patients. So depending on the severity and the amount of pain that my patient is in, we might consider physical therapy or chiropractic therapy in addition to medications. There are a lot of different medications that we can use. We do have medications that are specific for nerve-like pain, which is typically the main type of pain that patients experience with sciatica. We do offer injections that help with the pain as well that are extremely successful. We do these very often every week, and this helps patients quite a bit. Now, if patients try all of these things and they're still having a lot of pain, a lot of symptoms, that might be when we consider surgical consultation to see if the patient needs surgery. Typically, what we'll perform are epidural steroid injections, which can be done in a number of ways, but these injections are something where we put steroids around where the nerve is developing pressure for whatever reason, and this helps with the inflammation around the nerves as well as the symptoms in the spine as well as in the leg. So every patient's different. It's hard to give a set timeline as far as when symptoms can get better. When we do injections to help with this pain, it typically can take up to 5 days for the steroids to fully kick in, sometimes a little bit longer, but it also depends on things like lifestyle modifications with diet, exercise, physical therapy, medication management. So every treatment plan is tailored to each specific patient and their needs. So exercise is very important. The more active a patient can be, the less likely the pain recurs. The other thing that can be very important is weight loss, because the more weight on your body, the more pressure we have on our joints, on our nerves, on our muscles, and the more weight we have to support with things like walking, standing for long periods of time. That all does make a really big difference. Diet does also play a very big part, as some foods are more pro-inflammatory and can make it harder to treat the pain. Following an anti-inflammatory diet can help in regards to preventing the pain from returning and keeping symptoms at a minimum. Best next step would be to be evaluated as soon as possible so that we can figure out the specific needs for the patient. Again, every patient is different, so it's hard to give a very specific next step. They would need to be evaluated first so that we can guide them towards the appropriate treatment as soon as we can.